Once we had the first few cases of COVID-19, what we did was we immediately closed everything. So the DREAM centers that we're implementing with US government funding as a sub-partner to PACT, we closed all 15. But what we realized was the impact of COVID was such that it took all attention from issues around health, and all we're beginning to focus on was just the COVID-19. And so other areas of health were now getting affected. And so we found that the girls still needed some of the services that they now couldn't get because the DREAM centers were closed. We have to have a balance between making sure that we're protecting the girls from contracting COVID-19, while at the same time keeping them healthy and maintaining their well-being in the other areas that the DREAMS initiative provides support for.
I decided to live with my auntie and uncle, but when I decided to move in with my auntie and uncle, things changed for me. They started abusing me mentally, physically, and sexually. Yes, so there was a point that I decided to run away from home due to the abuse that I was receiving at their home. I ran away from home, ran away to a boyfriend because I didn't have elsewhere to go to. So after running into my boyfriend's house, I fell pregnant. After falling pregnant, he chased me out of his house, and I didn't have anywhere to go. I was so disturbed. I didn't know what to do. No one could help me out. Until I made dreams, they really helped me.
COVID-19 has really impacted negatively in our lives because some of our young women and adolescent young women in the community are not accessing the services at the center due to COVID-19 because of the social distancing, and obviously other trainings that we have at the DREAM Center have not taken place because of COVID-19. So if they do not visit the DREAM Center, obviously they go and engage into different activities outside the DREAM Center, of which we might not know, obviously sexual activities, which can also increase the number of HIV infections.
COVID-19 has stopped a lot of things from home. Like it has closed a lot of jobs, and then many young girls are at home right now. They have lost their jobs due to COVID-19.
There's the fear of this getting worse, and the numbers right now are rising, and so the question is, will it get any worse than this? And if it does, what do we do? We will move backwards, I guess, a little bit. I hope not too much. We all know every time there's a money problem at community level, it will usually have a negative impact on the adolescent girls and young women with their choices about protecting themselves and their choices about what they do to survive.